Good morning and happy Tuesday. My name is Rita Kaul. I'm a nurse here a community health nurse here at Two Rivers Public Health Department. Welcome to our monthly surveillance call. Come join me with a relaxing cup of coffee and help me admire these delicious looking cupcakes. It's National Diabetes Awareness Month, so we'll just be looking at these tasty treats. Let's see. Okay, we are Two Rivers. We're 7 counties in our district. Our population is 97,000 people, and it includes Buffalo County, Dawson County, Phelps, Kearney, Harlan, Franklin, and Gosper County. What we do at Two Rivers? Well, the last month in October, we've been giving flu and COVID shots to people at the schools, churches, businesses, and had so many full clinics here in the office. We had 56 clinics altogether, and we gave 1,062 flu shots altogether. Things are winding down now, so we can focus on other projects, phone calls, and other data collection that we do. Our mission at Two Rivers engages collaborative partners, community leaders, and the public to promote healthy lifestyles, provide preventive education, assure environmental quality, and create a more healthy and safe communities for all who live within this district. This is our nursing team. This is Jackie, our supervisor, and then the rest of the staff, and I'm up here in the corner. My name is Rita. Our website has changed. It is now Two Rivers Public Health Department.ne.gov. I don't know why that's not showing.
Click on it.
There. Okay. That's how you get a hold of our website so that you can look at the clinics, see when they're going on, see when we have our open clinic days here in the office. So it's just a really good resource to come and see, where and when things are occurring in our department. This is our region. We're Region 7. This includes Nebraska, Iowa, Kansas, and Missouri. So the COVID numbers, I just updated these on November 4th. So you can see we're moving along, but not by leaps and bounds like we were. So you can see here over the United States, there's 97 million confirmed cases. And then on a 7-day average per 100,000 people, we have 80.1% of our population with COVID. In the total US deaths are over 1 million people, 1,066,351. So you can see that, this is a very serious illness that we continue to battle here, and our work is not done yet. In Nebraska, we've had total confirmed cases of 533,636 with deaths of 4,550. So you can see here that actually our numbers are less than our surrounding states. Kansas was 888,000, Missouri with 1,673,000, and Iowa with 862. So you can see Nebraska is substantially less in numbers. So on the COVID data tracker, one thing to point out here is that the CDC has recommended we have an updated bivalent COVID-19 booster, and that was earlier this month. And so there are 26 million eligible people in the United States that have gotten one, but that is only 8.4% of the US population. Bivalent boosters help restore the protection that might have gone down since your last dose. And they also give extra protection for the new Omicron and the Omicron variant. So both Moderna and Pfizer offer that same coverage with the bivalent boosters. The flu season is approaching. The CDC recommends getting both your COVID vaccine and your flu shot at the same time. I think a lot of people question that. So if you haven't gotten your currently recommended dose of COVID-19, get that as soon as possible, along as well as your flu vaccine, so that you're completely covered. You can see here that our numbers are changing, daily, but this is the most updated information. I would like to point out a few things on this dashboard. On the top left, you can see that the 7-day rolling average in cases in 2022 is this orange line, which dropped below the numbers of cases, which we were seeing in 2021, shown by the blue line. So you can see we're substantially less in 2022. Looking at the bottom left, you'll see that the number of positive cases reported in red versus the total tested in orange. So you can see those numbers vary significantly as far as the occurrence of COVID. So when we look at the bottom right, you notice that the majority of the cases are reported in those that are age 30 to 39, and then there's a big gap to 70 to 79, and then the people that are over 80. In the top right, you'll see that the current COVID-19 community levels in Nebraska as reported by the CDC. So you can kind of see where we're at as far as Nebraska cases. Okay, this board just tells us the number, of cases in Nebraska. This is talking about the hospital bed cases. And so you can see here that the slide doesn't show the number of COVID beds. It's kind of covered up, but in the bottom left corner, you can see it says 4.17% of the hospital beds are COVID. So way less than it's been. So we are gaining as far as coverage goes and keeping people out of the hospital. Monkeypox is also something that we have to deal with now, in addition to COVID and the flu. Two Rivers Health Department is tracking the monkeypox outbreak with the Nebraska DHHS and the CDC. Two Rivers Public Health Department sends out a weekly monthly monkeypox report. The numbers continue to rise, with 28,000 through the United States as of November 4th. There are 31 cases in Nebraska. And globally, there's like 77,573. So you can see here, and it includes 102 countries. So we've got something new to deal with. So the CDC is recommending vaccination against monkeypox using the following strategies. So you can do a post-exposure prophylaxis. And for this current outbreak, this approach can be considered standard PEP for monkeypox. People can be vaccinated following exposure to monkeypox to help prevent monkeypox illness. You can also do PEP and expanded PEP, which means that people with certain risk factors are more likely to have been recently exposed to monkeypox. And this approach aims to reach these people with post-exposure prophylaxis, even if they have not had documented exposure to someone with confirmed monkeypox. You can also do pre-exposure prophylaxis. This approach refers to administering the vaccine to someone at high risk for monkeypox. For example, laboratory workers who perform diagnostic testing to diagnose monkeypox. Two Rivers Public Health Department has a limited number of vaccines available. So if you are interested, please follow the link or the QR code you can see in the lower right-hand corner of this slide.
Hi, Rita, this is Jackie. So we do have a question. So Nicole asked, besides flu and COVID, what vaccines do you offer at community clinics, specifically under VFC? So Nicole, it just depends on what clinic we're doing. So if it's a flu COVID clinic, then we always will have flu and COVID there. If we do a traveling VFC clinic off-site, then we do bring all of our VFC vaccines, both for VFC eligible kids 18 years and under. And we also bring our private stock that would match up with the VFC. So long story short, we bring all of the vaccines for children, the routine ones and the recommended ones. And we will offer those to both VFC children and private or insurance.
Okay, thank you, Jackie. That was very helpful. I'm sure to anybody listening to know that we do have a lot of services available at these vaccine clinics. And so it's to your benefit to come and take advantage of all of the different vaccines that we have available. So on the Health Alert Network, the biggest thing right now is that the respiratory virus transmission is increasing in Nebraska, including RSV, COVID, influenza, parainfluenza, and the adenovirus. You can access these links to see the current numbers. We've got a lot of graphs on here. If you click on these links, you can see what's all going on in Nebraska, and the numbers are rising. The current RSV surge and potentially forthcoming combined RSV COVID influenza surge underscores the need to strongly reinforce available prevention measures. You want to get your bivalent COVID vaccines, you want to get your influenza vaccine, and stay home when you're sick. If everybody would do that, it would sure help keep the spread down. We want to diligently pursue available treatment options. Unfortunately, there's no vaccination or specific treatment options for RSV. So that is the main problem that we're having now, is that we've got a lot of cases of childhood RSV. The predominant circulating COVID variant remains BA.5. However, there are newer variants of concern arising internationally that have been identified in Nebraska. So we are not free from getting exposed to those new variants that are coming out. You can see here the weekly influenza report. We're up by 90 cases, and that's a change from last week by 8, and so the percentage change is 2.2%. So those numbers are going up as far as influenza goes. But when you see down here for the RSV, that's up by 160 cases, or 2.3%. So more and more increases are being seen here in the hospitals, and our numbers, like when we review the data that's available for reported illnesses, our RSV cases are going up every week. For the weekly influenza surveillance report, you can see here that the seasonal influenza activity has just entered the moderate level at this time in our region. If you see Texas, Georgia, Mississippi, North Carolina, Virginia, Maryland, New Jersey, New York City are all elevated to the high level of influenza now. And then Alabama, Tennessee, South Carolina, and the District of Columbia have moved into the very high level. So the numbers are really increasing very rapidly. Flu vaccines have been updated for the 2023 season. Plan to get your flu vaccine this fall and your COVID booster. And the flu vaccines we do have available for all ages, and we do have the 65 plus that has a stronger medication in it. And the flu vaccines are providing a wide range of coverage for you. So it's really important to get those. I did want to bring up that we continue to do the free dental clinics. They're for ages 0 through 4. The next clinic is in Lexington. It's a Community Action Partnership. This is the address here. That's going to be on December 1st of this year. And so this will be the only clinic that's going to be available from now till through the first of the year. So if you have this sort of need or want to encourage people to participate in this would be a good place to direct people. And they can call the clinic here to be able to sign up for that. This is called the Life Smiles program. And you can go to Two Rivers .ne.gov, or you can call 888-669-7154. So getting back to the pictures on the front of our slideshow, you saw that we had some beautiful cupcakes there. So, and the reason for that is because it's American Diabetes Month. And the goal this year is to raise awareness about diabetes and to help share some helpful resources. So diabetes is basically a metabolic disorder that causes your blood sugar levels to be higher than normal, and it prevents the body from properly using energy from food and beverages. So why is it so important to be aware of diabetes? Well, 1 in 5 people maybe have diabetes and don't even know it. So it's really important to go have your regular doctor checkups and find out, what your blood sugars are running. If this goes untreated, you can have nerve damage, you can have cardiovascular disease, foot and limb injuries, vision problems, increased risk of serious cases of COVID-19 infection. So it's really important to stay ahead of where you're at with diabetes and making sure that you are staying healthy. Every year there's a different focus during Diabetes Awareness Month. And this year it is all about managing diabetes by building your healthcare team. So it takes a team to manage diabetes, but the most important person in that team is you for your diabetic care. If you have diabetes, or you have a family member that has diabetes or a friend, they need to be going to their dentist, optometrist, dietitian, their primary care physician, of course, to be able to manage their whole disease, but also all of these other factors. The diabetic educator is key to this whole team. One that's not listed on here is your podiatrist. It's very important to take care of your feet and to make sure that you have monthly care as far as your feet care goes. So it's very good to have that podiatrist on board. Along with the diabetes information and the team, it's really important to know your ABCs as far as diabetes goes. So your A stands for A1C, that's the blood test that measures your blood sugar over the past 3 months. The B is your blood pressure, and the goal is to keep it under 140/90. 120/80 is ideal. So you want to range more in that area rather than the 140/90. So just making sure you know what those numbers are and what you can do to help lower that. C stands for cholesterol. There's 2 types. There's the LDL, which is the bad cholesterol, and your HDL is your good cholesterol. So knowing those numbers and making sure that you are maintaining a good diet. Your LDL, you want to keep under over 100 milligrams per deciliter. Optimal is 70 with diabetes. So with diabetes, you have to be ever more conscientious. Your HDL should be 40 to 60, if not higher. So you want to, keep that number higher and your LDL lower. Total cholesterol should be 170 or less. So, if you have heart disease, you want it way less than that, but just kind of give you a ballpark idea of where you want to see that range. So some other tips about diabetes is that you need to seek support. Diabetes is manageable, and there are resources and people that can help manage it. There's a lot of diseases that we can't do anything about to control, but we can certainly manage our diabetes with a healthy diet, with exercise, with monitoring where we're at with our numbers. Staying up to date with your vaccinations. The COVID and flu vaccines are especially important for people who may be more likely to get sick from them. COVID-19 and the flu, people with diabetes, can be, more sick with with that diagnosis. Two Rivers Health Department COVID testing, we continue to do that on Mondays and Wednesdays. That's from 9:30 to 10:30. If you want to be tested, you do have to go to the website and make an appointment, and then there will be someone there to help get that testing done. We do have free testing kits being distributed from our office. They'll stop after our supply of 2,000 is gone. So if you are feeling like you need some, then you should stop in and pick up a couple free kits if you so choose. This is our calendar. It just gives you an idea of what's going on. It shows our clinics here in the office and then the clinics that we have in the other areas in our region. We continue to offer the COVID vaccines and the routine immunizations in our office. You'll always know what's going on with our organization by going to this calendar and looking at the calendar of events. Just be aware of the weather, though. If the weather's warnings have been issued, the mobile clinics would be canceled. So watch the weather, and you can always call the health department at 308-233-3100 to confirm your appointment. Remember to bring your insurance cards and your COVID vaccination cards if you do come in for your vaccinations. So thank you for your time today. Hopefully we shared some good information with you. Remember, it is Diabetes Awareness Month. So when making your Thanksgiving plans, think about what you'll eat at your family gathering. Will it be lots of turkey and green beans, or will it be those delicious treats? You'll get a chance to make good decisions this coming holiday. So choose wisely, but do enjoy that special treat and plan it into your meal choices. Are there any questions? Here. Okay. Okay, if there's no questions, then you have a good day. And oh, by the way, go out and vote. It's very important. It is your privilege.